We're pleased to have back Dr. Sreedhar Potarazu, CEO of Vital Spring Technologies. Welcome, Sreedhar. Good to see you.
Thanks for having me back, Liz.
Okay, obviously there are some concerns about this appointee. I've never seen an appointee where people aren't concerned in Washington, or at least on the one or the other side of the aisle. But what are the three things, the three R's that you're worried about with this new appointee?
Yeah, that's a great question. The three R's I'm concerned about. If you read into the history of Dr. Berwick, or he does talk about his favoritism towards rationing. Now, the reality is that every healthcare system does ration. But the fact of the matter is, with his passion for the British healthcare system, which is far from nirvana today, that without the right data, people are ultimately going to get less quality care if we head down the path that he's proposing. The second R really talks to redistribution. He's truly of the belief that the wealthier need to pay for the poor. But the fact of the matter is, Economics 101 will tell us that the poor are not going to simply succumb to more taxes. They're going to find other means to not have to pay, which means that the burden of healthcare costs is going to go right back to the businesses and consumers. And really, the third R is around rewards. You know, he really favors rewarding doctors, which is good in terms of performance. But the rewards really need to go to the everyday consumer for taking better care of their health. And a lot of business executives don't agree with some of his economic policies. So there's a real disconnect in terms of what he's done in academia and how the numbers really don't add up in terms of the implementation.
All right, Dr. Potarazu. Now, will taxpayers and companies essentially be dealing with a new American version of the British-style system under Mr. Berwick, Dr. Berwick?
I think it's possible. You know, the fact of the matter is that if the government were so confident that his experience was truly something to be touted, then we would have seen him testify last week. I think the greatest concern is that the jury is still out in terms of the public's acceptance of the new law, and the fact that what he's proposing does head down the path of a public option. That was always, I believe, the desire of where we want to go with this plan, of what the government wants to go for. And there's no question that he's a proponent of that. And the National Health Service in England is far from an ideal situation.
You know, let me challenge you on something, Doctor, and I know that I can do that because you like to be challenged. And certainly when you say that surely he would have been questioned before one of the subcommittees or the committees over this, and that's why they did this. You know, we should remind people that President Clinton did this kind of thing, meaning make sure that somebody kind of got in without any congressional looking at. He did it more than 100 times, but President George Bush did it more than 170 times. This is nothing new to invoke this kind of usage to get certain appointees into their positions.
You know, Liz, you're right, it's not new. But the fact of the matter is that the huge message behind all of this, number one, was transparency. The greater concern that everybody has right now is how much this new law is really going to cost. Right. Even during the Bush administration, we had some issues when Tom Scully was in office in terms of the Medicare de-prescription drug, and you know, he ultimately had to give up his job because the numbers were wrong. You're talking about somebody who's going to be heading up a highly influential part of the government who has discretion over billions of dollars. We were all still concerned in terms of whether the math is really right or not, which is why transparency today is more important than it ever was. And the fact that we didn't have it in the past, whether it was Republican or Democrat, doesn't make this any more right.
So you're saying essentially, before we go, he's going to be overseeing spending, I think that's more than what we spend on the U.S. military, right? Medicaid's the biggest part of the budget.
Absolutely. And you already have seniors that are extremely concerned. You know, they've gotten their drops in the bucket with regards to fixing the donut hole, but I think you still have a lot of seniors that are concerned about whether they're going to lose and how they're going to lose Medicare Advantage and a lot of their benefits. So we are clearly not out of the woods in terms of convincing people that Medicare is going to be saved and that our children and our grandchildren are going to actually have Medicare.
All right. Dr. Sreedhar Potarazu, great to see you. Thank you so much for joining us.
Always good to be back. Thank you.
Anytime.